tuned to Evergreen Media Network. I am Cindy Schwartz. This is the Patient Partner Podcast. We are also on Talk Radio, so look us up on that on iHeart Talk Radio. My co-host is Jeannie Roller. She is in Indiana. I said that wrong, Jeannie. Indiana. That's the right word. And I am in South Florida. Jeannie, we are talking about, this is unreal. That is, oh my goodness, what other carnival act are we as patients going to have to put up with? These are our opinions on these podcasts. They are. We're not doctors. We're not lawyers, anything like that. It's things we read, people that we know, care that we've seen happen to ourselves and also to other people calling in, people emailing us. A lot of people don't want to come on the show because they're just afraid of getting sued. They're afraid of all kinds of stuff. One gentleman I remember a while ago, and then we'll get to the subject, is he got of the hospital that he went to, he was having some arguments with them, and rightfully so as far as with the story that we heard, and they actually had him almost arrested for trespassing because he was trying to get his medical records and they didn't want him to have them. They didn't want him to have any ammunition. So this is, that is kind of a carnival act. So we're talking today of this doctor that you are very familiar with about now the insurance companies sending, is it through drug companies to your house? Go ahead.
Yeah, it's through your Medicare Advantage plans, really.
Okay.
Of course, it's senior people, and I know this for a fact. It's just not one insurance company doing it. There's multiples doing it because they are doing it to my mother. And they went to this man's house and they were doing tests on him that this cardiologist said should only be done by a cardiologist because you have to have special machinery and it has to be ran in a certain way, etc. So they were doing these tests, and he was having these tests done by his cardiologist, by the way.
Okay.
But this insurance company insisted that they needed to come to his house and do it themselves. So they did, and then they said that he needed a heart monitor, and he didn't. But then this cardiologist was saying this is how, bad things happen, because then these insurance companies can charge Medicare for chronic illnesses that people really don't have, because this test showed that this man had something which the cardiologist said is completely normal to have at that age.
Right.
And they get more money for that patient.
Mm-hmm. And I want to say, I watched the video. The patient that we're talking about was like 84 years old, something like that. And he was really, really in good shape. The cardiologist, I kind of couldn't believe it. But this is just normal across the board. Somebody about that age would have, going on. It's not anything to be alarmed about. You don't have to do anything about it specifically. It's, we just monitor, maintain, basically, from what I remember seeing in the video. And here we have the insurance company. And this is my opinion, they must have read something on this guy's chart that said, ding, 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 let's go after this. And of course, when you get older, there are things that are going to happen. It's something, your knees wear out, but you don't want an operation. You're going to do this, you're going to swim, you're going to do, take supplements or whatever you're going to do. It's your business what you're going to do. And the minute that stuff, you and I talked about this, Jeannie, and I know for a fact with the blood pressure stuff, they continually want to use in every doctor's office, because medical assistants are not necessarily trained to the umpteenth degree of medical devices and all that kind of stuff. The easiest thing is to use a digital blood pressure cuff, whatever you want to call it, device. Every doctor that I know of worth their Hoyle says insist on getting the traditional mechanical blood pressure cuff taken, where they have to let the air out in the whole bit, because that is a more accurate reading. Who knows when those digital ones are calibrated? And once you get that 188 or 186 over 88 or whatever, that's on your record. That's on your record. And it's like what this cardiologist is saying, that 84-year-old man had that on their record from him, from the insurance company, not from him, the cardiologist.
Well, and I know this for a fact that these insurance companies are doing that, because my mother lives with us. She's getting these calls, and these people get pretty darn hostile with her because she refuses them. And they say, well, we're just going to show up. And she said, well, we have it posted no trespassing. If you show up, then you'll be charged. And what they want to do is they want to bring a team with them.
Okay.
And they want to evaluate the house, the whole house. They want to have a team of different people to do things to her that she's having done anyhow every 3 months at her doctor's office.
Right.
And that's what she tells them. She knows if she's sick to go to the doctor.
Mm-hmm.
And he monitors her, and she doesn't want them. But the thing is, I mean, they wanted information. Who's she living with? What do we do for a living? How
Right.
much money do we make?
Right.
It's like, what? This
Yeah.
isn't healthcare stuff.
No.
That is really none of your business. And Cindy, with all the crime being, happening against older people nowadays, how do you know who those people really
Right.
are? And who do
Exactly.
those people know? I mean, they're taking pictures of these people's houses and what they have, and then they have 5 or 6 people in there, and you can't keep track of who all's going where and doing what in your house.
No.
So, I mean, it is kind of a dangerous stuff. And, my mother has an irregular heartbeat every once in a while. The cardiologist is fully aware of it. He said for her age, from 94, she's as healthy as a 70-year-old.
Right.
So she doesn't need any of
Right.
this stuff.
Right. Well, that's what.
And
Yeah.
so,
This. Mhm.
yeah.
That's what this
But,
cardiologist
the
was saying
insurance,
about his patient. It's my patient. I'm the doctor.
yeah. But the insurance company is contracting out with these companies. And, I would love to know who owns these contracted companies. When you get down to the bottom, I would like to know who really owns these companies. Is this another form of kickbacks for insurance company? Now, that's what I wonder. So
Well, we'll have to. We'll have to look into that. Well, it's always the Circle One. Not interrupting you. Circle One was we're all going back to the same big pot of money, and it's a big pot of money. I don't care what people cry about it. There's a lot of money that we're paying a lot of money for this health care, and there's just too many hands in this pot, and not enough people getting some good care out there.
Right. And I mean, all this is. They said, well, no, this is free. Well, it's really not free, Cindy, because they keep increasing rates.
It's not free.
And they keep increasing what they need Medicare to pay. And guess what? That makes your taxes go up.
Right.
So in the long run, none of it's free.
No.
And, it's like she tells them, I go to the doctor. That's where I go. That's who I want to give me my care. But a lot of people are getting into this because these people are quite forceful, at least the ones that's been calling her. And it's like, give me the phone next time they call. I'll talk to them.
Well, and it's, it's almost like the fact, and the HMOs. Remember that years ago? And it was like the insurance company was going to decide when, what, this, where, how going to happen. And it wasn't the medical professionals that were deciding this. So to get a cheaper rate, I think it was, but, don't quote me on that. Again, my opinion, it wasn't cheaper. You were getting substandard care. And you were waiting in line. Yeah. It was almost like socialized medicine. You were waiting in line to be, not confirmed, but, to get the go-ahead to do this, to do that, and whatever. And that's not what the healthcare is about. If you need it, you need it.
Yeah. And to me, it looks like that's what we're getting nowadays, only they call it something different. That's my opinion.
Yeah. That it's going back to the old HMO where they decide whoever they is, the powers that be that are getting the money, they decide, the coding, all that kind of care. And here are the doctors again, the poor doctors, they're trying to do their best. I mean, most of them do. In my opinion, they do. They're working really hard. The nurses are the ones that are in it for the right deal. And look at the garbage that they have to put up with just to try to take care of a patient, the red tape and the, paperwork and everything else. It's crazy.
Yeah.
It is crazy.
And, you got to wonder if the doctors, if your primary physician ever sees this stuff that the insurance companies are doing, by sending those people out, if they actually ever see it. I bet quite a lot of them don't, because if medical records from hospital systems, if a patient goes to a hospital system, a lot of times doesn't get sent to your primary care doctor.
Oh,
because their medical record system may not talk to that medical records system. So, there's just a whole slew of things that can go wrong there.
And you know what, really, to consolidate this real quick, we only have a couple of seconds left, and I've read this many times, heard it many times. Mayo Clinic has this down to a science where everything is done in the same day, and why cannot the rest of the country, the rest of the facilities get it down where you go in, as Cindy Schwartz, you do this, and at the end of the day, you've seen 3 doctors, everybody knows what's going on, and blah, 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 blah. That's the way it should be. And the rest of this finagling and all this other stuff going on is exactly that. It's just finagling, trying to get more money out of people for less care, less work. Stay listening to Evergreen Media Network.